Hello, everybody. This is the Nairobi Ideas Podcast, a podcast that gives a public platform to the Africans changing the world with their big ideas. I'm your host, Korir Mugo of the Mawazo Institute. On March 11th, 2020, the World Health Organization declared COVID-19 a global pandemic, and it's safe to say that for many of us, things changed drastically on that day. The role of mass media in communicating both the science of the virus and in helping us understand our new realities cannot be underestimated. How is mass media on the continent responding to the pandemic and fighting both myths and disinformation? How is the pandemic changing the region's media landscape? We invited someone who's been working on health media coverage long before the pandemic hit to help us answer these questions. Welcome to the show. Can you please introduce yourself to us?
Thank you, Kari. My name is Dr. Mercy Korir. I like to introduce myself as a medical journalist. Currently, I work at the Standard Group as a health and science editor. So my work basically is to look at all the health stories, all the science-related stories, and this touch on climate, the environment, and conservation, and any issue really that affects health, and purpose those stories for our electronic media, that's radio and TV, for our print media, audio and radio. On social media, I think that's the other frontier that we haven't really conquered. So basically, that's the kind of work that I do. I have a medical background. I did my training in medicine and surgery, but after some time, the question was, what more can I do as a doctor? And so I decided, instead of sitting in a clinic and treating patients there, let me go and sit behind a microphone like I'm doing now in front of a lens and treat and assist people from that perspective.
You have a really full plate. And I'm really interested or fascinated by this idea of going from medicine to media and communications, which seem like two very different areas of work or fields of interest. So, can you briefly explain to us what led you to be interested in this area of work around journalism and science communication and using the media to, inform people on health issues?
Immediately after I finished medical school, I was posted to do my internship, basically that one we do in the public sector. So my experience there, it was good, learning a lot. But then after internship as a medical officer, I used to still work partly in private institutions. And that's where I saw the disparity between the people who access the public health sector and the people who access the private health sector. And basically, by the time a mother came to see me when I was in the public facility, the child was really, really sick. They actually needed to be admitted. They needed, some intense attention. But in the private sector, a child would have a flu or would be just feeling a little bit unwell, nothing very serious, and the parents would come. And the difference, one, was on knowledge, two, on even just knowing where and how to access health facilities. And the most important bit was having the means, or they could afford to take the child because they either have an insurance cover or they have money that they can do that. And I thought that was not fair because, all of us are children of this land. So I thought maybe there's something else that we could do in terms of, creating awareness, teaching Kenyans, parents, mothers about health seeking behavior. I just felt like there was more that could be done on a larger scale in terms of just making people aware and informing them of what to do, what not to do, even just teaching them on, preventive measures on disease. And so I thought about what or how can I do this? So back in medical school, I used to be the editor of our medical school magazine, and I've always loved, I think, writing, a bit of journalism. So I thought, since I'm already interested in this thing, could we merge it? And it started quite literally as an experiment because I was telling myself, if it doesn't work, I tried. But yeah, the experiment is here and it is continuing.
I love that you're calling it an experiment. And I think the kind of work you're doing is so crucial and important, especially in fixing this disparities that you're talking about. Because a lot of people still, read newspapers here, still listen to the radio, still watch news on the mainstream channels. And so to be able to provide that kind of health information in a way that's easily accessible to them, I think it's very meaningful. And so if I can just kind of switch focus a little bit, in the last year, you've received a lot of recognition for your work in the media, where you're countering myths and disinformation around COVID-19, how it has spread and its treatment. But long before, the pandemic, as you've mentioned, you were working on science communication as a health reporter at the Standard Media Group, where you helped establish a health and science desk. So, in your own assessment, what changes have you seen in health reporting in Kenya or the region in the last few years?
For me, the biggest change that I saw was for the first time, health was prime content. You could open the newspaper and on the front page you have a health story, and it's no longer just politics. People are interested about health. When you go on your TV, your prime time health was actually a major story. It could be one story number one. You go to your radio, people are talking about health. And for me, I think that was the major change. And what I usually say is that COVID-19, the pandemic accelerated, the realization that health is important for the population, and two, for media as a fourth estate. We have a role as in journalism school, we are taught is agenda setting. So we have that role, and I could see that deliberately, the editors, the people who are known as the gatekeepers, are really thinking about what more can we report about COVID? What else can we say about COVID? Who is the best person to report on this? Who is the best person to interview and tell us about this? And so for me, that was a really, really major change. And I see it's still happening. For my media house, as you said, because of COVID-19, because of the realization that health is important, then the media house thought and said, it's important then for us to have a dedicated team, a health and science desk that will be covering health and science issues that relate to health. And from there now, it's not just about COVID-19, but now we are looking at what other disease areas, what other health areas are of priority that we can prime, that we can talk about, that we can inform the public about. And I see that in other media houses. I think now people are seeing the relevance and the importance of people who know and understand a little bit about science, a little bit about health, for them to be the ones reporting. And this was because, with COVID-19, when the pandemic struck, all of us were wondering, what is this virus? So as the scientists, as the researchers were learning about it, so was the public. And so it needed somebody who could quickly synthesize whatever the researchers, whatever the scientists are coming up with, and translate that in a manner that the lay public would understand. So the other major change is the realization that people or reporters, journalists who have a little bit of background or a major background in science and health would be important in the newsroom. The third key thing that I've seen, or the third key change that I've seen, is that now we have taken scientists, researchers, doctors as key people in society, or as important sources of news. Before we could think, when you're thinking of interviewing a doctor or a researcher, it's when there's something major that has happened. But now we're seeing that deliberately people are looking and finding out which scientists are in this field, which doctors are specialized in this, who can we talk to. It's no longer just because somebody is a doctor, they can come and be interviewed on in studio. People are looking at who is the best person. And so we are getting an opportunity to unveil or to discover the kind of talent, the kind of professionals that we have as a country, as a continent. And for me, those three key things really are important in pushing the health agenda. So having been in the newsroom before the pandemic and now during the pandemic, I think we are on the right path toward elevating health to being an important part of society.
Mm. And I completely agree that, one of the unintended side effects is that science and health is really getting a celebrity moment. And this is our opportunity to find ways to make sure that the translation of science is kept. And I love what you're doing, and it's great to hear that this is a change that is happening outside of Standard Media Group, and that you feel encouraged to see other things happening in other media spaces as well. So, what is your assessment on how well the media in places in Africa is doing in coverage of COVID-19 and the pandemic? And I realize this is a very broad question because we're talking about a very big piece of land with multiple people, multiple languages. So I put that to the side. But if you could just give an assessment of maybe a region or Kenya, or how you feel the coverage has been going so far.
1.3 billion people in the continent. Well, I think they say you give to Caesar what belongs to Caesar. So I'll give credit where it's due. And the journalists in Africa, I think, have done a very good job. COVID has made, everything much easier. Everything is almost virtual. So we used to attend the WHO briefings, both from Geneva, even the ones that were here in Africa by the Africa team. And because we had an opportunity to ask questions or, to be able to interact with the panelists or the people, the discussants in the media briefings, the kind of questions that the journalists were asking, for me, were encouraging because it was, those questions that people ask with the intention of providing a solution to their audiences. It's not, for example, when there was misinformation that Africa is warm, so the coronavirus is unlikely to get to the continent. And when you're interrogating those kind of conversations, you could see that people are actually looking for answers to get what the truth of the matter is, so that they can inform people, so that they can get prepared. And so for me, from the quality of journalists, the quality of questions that were asked, I could tell that as a continent, we have professionals in journalism who know what they're doing. The second bit was, and here in Kenya particularly, was people or journalists holding governments accountable. Obviously, there are African countries where it was a struggle, like Tanzania, for example, because the then president, the late president in Tanzania, actually said there was no COVID. In Uganda, on the other hand, they took the matter very seriously, and that's why they had less COVID compared to Kenya. So you could see that journalists were doing their role as a fourth estate in holding governments accountable. In Kenya, when there were questions about how we used the COVID funds, whether they were embezzled, whether healthcare workers were being provided with the right protective equipment, the journalists were there to follow up that story, and they follow it to conclusion. So I think as a continent, we came a long way in one, quickly learning about this monster that nobody knew about, this thing that nobody knew about, and being able to quickly channel that information for the public in whatever means, electronic, digital, print. People are being able to do that. The second bit was the journalists themselves attending trainings or sitting down with researchers and being able to build their own capacity in understanding what is happening. We've seen that quest and hunger for information also translating to the issue of vaccination and people keeping tabs with the vaccination. And I know there are very many misconceptions, rumors about the vaccination, but the journalists have been able to step up, and fill in that void. Well, I don't know if journalists and media houses can do anything more, but for me, two things. One is not to drop the ball. COVID-19 has shown us on how we can report health, how we can better improve health reporting by continuous, learning, capacity building. And two, then would be that the media houses, the media owners deliberately invest in human resource. Media is human capital intense profession. I mean, even if you have all the fancy machines and everything, they're not going to write the story. They're not going to do the interviews. You actually need somebody in there between the source of information and the audience. So for media houses, for media owners to invest in capacity building so that the journalists, not just in health, but now looking broadly at society, when it comes to the economy, when it comes to, agriculture, sports, to invest in journalists who have an understanding of that key area or that primary area, so that now they are able to better inform society. Because at the end of the day, we are here to make society better. And we as journalists, our role is to leave the places where we found much better than we found them. So I think those two would be my key challenges to my fellow colleagues in journalism, and particularly for the media owners and other stakeholders that see media as a key driver of development.
I think all of that is so crucial. Africa is a place where a lot of people still rely on radio, still read the newspaper, and really being able to provide accurate, knowledgeable information to people about to their lives, because this is what we're talking about, how people are living in the society that we're in. So thank you for that challenge. A lot of thinkers, a lot of experts, a lot of people on the continent point to the fact that the region has dealt with previous pandemics and epidemics, and that we have the expertise and the know how. And I'm just wondering, how do you think coverage has changed since the HIV/AIDS epidemic of the 80s and the 90s?
Well, unfortunately, I was still very young when they were covering HIV in 80s and 90s. But I remember when in high school, that was in early 2000, and they would bring these clips, were they stories of people living with HIV, and they were really traumatizing because I don't know if you remember them, where people were emaciated, people were really sick. Then they were showing us some of those STIs, and it was really traumatizing. But what that did was stigmatize people living with HIV. So if you look at how we started covering COVID-19, people with hazmat suits, what people call space suits, you couldn't touch people, people were being buried like dogs. It was that initial coverage really mirrored what we did with HIV, which was not really helping the cause, because what it did was stigmatize. And I remember I talked to a nurse who was not even allowed to see her husband, another nurse, who died of COVID-19, because, all of these protocols about the disease being highly contagious and infectious. And that's the time when we hadn't known that, bodies could not transmit the disease. In her neighborhood, the border riders refused to carry her children because, that is the house where somebody with COVID died. When they went to bury in the church, the priest did not even give them time. You want to pay tributes, you want to see something, you want to take your time to mourn this person, but they are not even given that time to. And out of everything, that is the thing she remembers about how society stigmatized her because of this disease. And that fell squarely on how we covered it, of, this scary thing, you're spraying everywhere. It was important and we didn't know. But when I look back, I thought maybe we could have done better as a media house in terms of, not filtering and not putting everything out there, because the impression that people got was, you get this thing, you touch this thing, and you're gone. Then I see now, doctors just have their scrubs, they have double masked, and they go about their duties and they sanitize. It's not as scary as it was before. So in that regard, our coverage really didn't change much between HIV and COVID. Almost 40 years later, the coverage wasn't that different, and maybe we could have done that, because now we are working hard to reverse the stigma that has come with um, somebody contracting COVID-19, and it is a lot harder to reverse that stigma. And you see, 20 years, 30 years later, we are still working on reversing the stigma that comes with HIV. The plus side of coverage of COVID-19 was, and I think this mainly goes just to technology. Because of technology, the world was one village. I could go to the WHO website and everything was there. You go to the CDC, Africa CDC or US CDC, whichever CDC, and the information is there. The experts were recording the information on social media, or they are posting on social media. If you needed somebody, you could do an interview on Zoom. So it made it much more easy and more accessible to get information, to get the right kind of people to be able to do stories on, or to be able to debunk some myths, to be able to clarify a few things. So the technology made coverage of COVID-19 much, much better and easier as opposed to back then when we were doing HIV. And I think probably that's why within a year, we've been able to move from, oh my God, this thing will kill us, to a point where we know that you mask, you sanitize, you keep social distance, you get your vaccine, and you're good. You protect yourself and you protect others. Within a year, we've been able to do that. And I think if we didn't have such ease of access to information, then probably would still be struggling to cover the pandemic. So I think we have definitely improved, and hopefully when it comes to covering the vaccination, how we are doing the vaccination, we can do better. And I'll be remiss if I don't say this. One of the things that are dear to my heart is how Africa is lagging behind on vaccination because of vaccine nationalism, vaccine geopolitics. So I'm hoping that my colleagues within the continent, myself, will be able to bring out this thing, because with a population of 1.3 billion people, really, as a continent, we would be able to stand on our own 2 feet if we really wanted to. I mean, what stops us from manufacturing our own vaccinations? What stops us from funding our own distribution and administration of vaccines? Do we have to always rely on donor funding, to always rely on donors? And I like what Strive Masiwa said in one of the meetings with WHO in Geneva, that, donations are good, yes, but you'll always be at the mercy of the donor. And as an African continent with 1.3 billion people, what stops us from not being dependent on the West all the time? And we've seen what is happening now. I don't think we've even gotten to 4% vaccination rates in the continent, yet we are targeting 60%. And something needs to be done. And I think if we as journalists, if we as stakeholders in the health sector, we as reporters in health, were to take this conversation a notch higher, if each corner of the continent is talking about vaccine nationalism, the disparities, the unfairness, and everything that goes around it, then we'll be able to change the narrative of this continent. Then our future generations, our children and our children's children, will not have to go through what we go through. If you look at the Indian subcontinent, almost similar population, but they are a force to reckon with in the health industry. Why can't we do that as an African continent? And for me, that would only be achieved if we take this as one and a key agenda in our media spaces, and two, we prime that as an important bit. And as I said, media for me is an enabler, a driver of development. And once we start having these conversations, then we start telling our own stories in our own way, and we'll be able to get our own solutions from that.
Strive Masiyiwa is a Zimbabwean billionaire who is also the head of the African Vaccine Acquisition Task Team. I'm glad that you've pulled out the idea of, the role of the media in promoting conversations around the vaccine rollout in the region. And this is a major challenge that the continent is facing. We currently have a shortage of 470 million doses through COVAX. And I'm happy to see that there are other efforts to try and acquire vaccines for the continent through, for instance, the African Vaccine Acquisition Task Team. But I'm wondering, as a reporter working in the media, what are you seeing, broadly speaking, about reporting on the vaccine? For instance, what are some of the common myths? Are we seeing vaccine hesitancy? What's happening in reporting around this?
Myths, misconceptions, misinformation, all of these things, I think, are some of the things that we are always working to correct, to rectify, to debunk every other day. Social media, I usually see it as a double-edged sword. When you have positive information, it's a good place to spread positive information. But when there are myths and rumors, that's the place where they spread the most like wildfire. And I think the commonest myth, and I think my colleagues in other African countries have come across this, is the issue of infertility, where people think, once I take this vaccine, I'm never going to have children, and there's been no proof of that. Then the issue of myths, oh, there have been so many. There have been so many. Then the other thing, which is on hesitancy, is the fact that, people are saying, even if you get vaccinated, you're still getting infected, or you can still get infected. So there's no point of getting the vaccination. So they're like, no, I'll take my chances. Then they double that up with the misconceptions that you get the vaccine, you'll get really sick, or you'll get blood clotting, you'll not be able to, you may cause death, and trying to teach people that, this the vaccine prevents you from getting severe disease or even dying from the disease. And it has taken a lot. And as I said, for behavior change communication, you have to be consistent and repeat the message every now and then so that people are able to understand and with time be able to, because your target is for somebody's behavior to change, not just temporarily, but for good. And then so that these particular people become, the ambassadors. The other difficult bit on the vaccination was the healthcare professionals themselves being unwilling to take the vaccination. So people who are like, my neighbor is a nurse, she says she's not taking the vaccine, or, my doctor said they are not taking this vaccine. So these are people of authority in society. So if you yourself as a healthcare professional is unwilling to take the vaccine, then the people who you should be encouraging to take the vaccine are not going to take the vaccine. So at that time, I remember personally, I took my vaccine on camera so that at least, people see that you are able to take the vaccine. And I realized this because when we were covering COVID, I remember the first time I wore a mask to a press conference, then people started embracing and appreciating the wearing of masks. And so I thought if I do the vaccine on camera, then at least many more people would take the vaccine. When I did my test again on camera, at least people stopped fearing and, it sort of demystified everything around it. So we still have a lot to do on vaccine and making sure people take the vaccine so that, it's the only way really to slay this or to slow down the pandemic.
I appreciate that you brought out the hesitancy even among medical professionals, because I remember a friend of mine who's a medical doctor, not trusting the vaccine. And he did get it, but I was so confused. I'm like, but you are a doctor and you know the science. And I just cannot understand that. But so this speaks to the idea that there's still a lot of fear out there. There's still a lot of uncertainty. So to our listeners who are, maybe not sure, still making up their mind around, should I get the vaccine? What's one thing you can tell them that maybe reinforces their trust in the efficacy or the safety of the vaccine? What do you tell people who are not sure?
Okay. Let me start from the data point of view. And what we have seen, and we saw this, Israel was among the very first countries to have high rates of populations vaccinated. The UK, the same. And what we saw, and I remember talking to one of my doctor colleagues in the UK, was while initially during the pandemic, she works in a care home. Initially during the pandemic, when there was a wave, then they had so many seniors dying of COVID. But when they got vaccination, it became just like a wave of a flu, then they are okay. Nobody dying. So from what we have seen, the vaccines work in terms of making the COVID infection less severe and making sure you don't die from COVID. Two is just to appeal. If you think about, we're still in a continent where, unfortunately, we still have to pay for healthcare. So if you think about it, this vaccine is free. You will probably have side effects, which some paracetamol will sort out. That is free. But if you think on the flip side of it, if you get COVID-19, God forbid you need ICU. In certain places, the minimum deposit you need to make at an ICU is $6,000. Do you have that money lying around? If you're in that hospital, obviously doctors are going to do their best to keep you alive and to try and make sure you go home. If you do not make it, then your family, your friends will be left with a hefty bill in millions of shillings or, thousands of dollars to pay. Do they have that money? You will leave your family impoverished. And we usually say, as a continent, unfortunately, you are one sickness away from poverty. Is that the kind of life? Is that the kind of legacy that you would want to leave your family just because you're hesitant about taking the vaccine or you want to take chances about taking the vaccine? If you live, then you would be spending the rest of your life trying to pay out or to pay off an hospital bill. You'll probably sell the little that you have acquired, spend all your savings on this. Is that the kind of, the kind of life that you want for yourself and your loved ones? So for me, when I look at it, the vaccine is free. It will stop me from, suffering all these consequences. Then I'm taking the vaccine. And the other issue is people trying to figure out which vaccine is better, and my answer is the best vaccine is the one in your arm.
Mm.
The best vaccine is the one in your arm. So whichever vaccine you get, they are all going to do the same thing. This scientific thing, I usually say those are academic, about 90%, 60%. At the end of the day, what is important from all of these vaccines is, does it prevent you from getting severe illness? Yes. Does it prevent you from dying? Yes. Then take the vaccine.
Mm. That is such a powerful, powerful argument. The vaccine is free, hospitalization is not. Thank you so much for that. So, we always end the podcast by asking our guests about what their big idea is. So, looking ahead, and I think you touched on this briefly, but if you could summarize for us, what is your big idea for the role that the media can play in strengthening the region's response to COVID-19 and perhaps future crises?
We should tell our own story. We should own our own story as media. As you had said earlier, we are a big continent, 1.3 billion people, many countries, many languages, many cultures, many religions. We should tell our own story. If you are to take me to South Africa, for example, I'll not tell the story of South Africa the way a South African would tell that story. If they were to come to Kenya, they would not tell the story of Kenya the way I would tell that story of Kenya. Even in Kenya, considering how many tribes we have, I may not best tell the story of tribe A from tribe B. So we need to learn to tell our own story, to own our own narrative, so that we are able to get solutions that work for us. So we need to contextualize, we need to, tell our own story, because the way we see and understand things is different. The African continent is diverse. And so if we learn to tell our own stories, we will be able to get solutions that work for us. In the pandemics, if they come, in any healthcare situation, in any healthcare crisis, we'll be able to learn that. And we've seen from the Ebola outbreaks, we've seen now from COVID-19, we've seen from some of these, infectious disease outbreaks that are happening, that each society responds differently, each society understands things differently. And if the messaging and the story is told according to that particular society, then one, you're likely to get a faster, swifter response from that community. So if we're able to own our own narrative and tell the stories from our own lenses, from our own communities, then we'll be able to marshal the support that is needed to provide solutions and lasting solutions, and be able to get people really buy into anything that comes on board. Like now, what you're trying to do with convincing people to take the vaccine. So you'll be able to get government working very well with other stakeholders in the health sector, with the community leaders, with other people who have a say in those communities. I remember when we were trying, or rather, when the county government of Mombasa was trying to, have people adhere to the protocols, don't congregate, curfew hours, and things like that. And it was really becoming difficult. But it took the intervention of the sheikhs, their community leaders, to talk to the young men, and they listened to them. And from then, the COVID-19 numbers started going down because the people in the community who people respected and listened to. So I think those are the kind of things that we need to do. Those are the kind of stories that we need to do more, that relate to the different, societies, so that we have lasting solutions, so that when anything else comes in, be it a pandemic, be it another crisis, then we are able to know how to respond, and respond fast, so that we don't waste time and end up losing many lives.
Thank you so much for that, Dr. Mercy. I'm so happy that you joined us on the podcast today. So much to think about, so much good information. I also want to quickly plug your podcast, Doctors Unmasked, where you talk to Kenyan doctors about why they got into their specific fields. You could also find Dr. Mercy on social media. She is very easy to find, Mercy Korir. We'll have some links to her work and some of the articles and things we mentioned in this episode in our show notes. Thank you so much for being here.
Thank you very much. It was my pleasure, and I look forward to hearing from the audiences. This is always an ongoing conversation, as I said. As long as we are alive, health will always be an important part of us. So I look forward to continuing these conversations on health as a health advocate, and have many more people, like-minded people, joining the bandwagon, particularly in the media space. Being the only person of my kind, that's a bit lonely. So the more people that we'll have there, the better.
Okay, listeners, Dr. Mercy needs some friends in the media space. Join her, please. Thank you so much. To find out more about our guests, find links to information shared in this episode, or to listen again, you can find us permanently on the Nairobi Ideas podcast page at mawazoinstitute.org/podcast. You can also subscribe to the Nairobi Ideas podcast on YouTube, iTunes, Spotify, Stitcher, Google Play, or wherever you get your podcasts. The Nairobi Ideas podcast is brought to you by the Mawazo Institute, a Nairobi-based research organization focused on female thought leadership and public engagement with research. New episodes drop once a week on Thursdays. Till then, from all of us here at Mawazo Institute, bye and keep it nerdy.